Hello, my name's Ted Williams. I had the pleasure of being the Deputy Director and the Director of this department over some 9 years and 6 different governors. One of the stories that I remember very well is when I was on the governor's staff, we actually selected the first, in those days, the permanent director for the department, who ultimately was Suzanne Dandoy, Dr. Dandoy. When Dr. Dandoy was selected, she had a bit of a problem in that she wasn't, from a statute point of view, qualified. She was a board-certified epidemiologist, had worked all her life in governmental settings. However, the legislature, in its infinite wisdom, decided that they did not want a previous individual who had been part of the public health department to be able to be considered for director of the new combined health department. So they inserted in statute, a statute that is still in place today, they inserted in statute a requirement that the director have private sector experience with some type of increased responsibility. Well, Dr. Dandoy didn't have that private sector experience, and she'd always worked in a governmental setting for CDC and other public health type organizations. So what we did from the Gov's office is to contact the Southland Corporation, which was then the owner of 7-Eleven convenience stores. And we placed her in an administrative role, at least they placed her in an administrative role at the Southland corporate offices for 2 weeks. And after 2 weeks, she was promoted to another administrative responsibility. And after a month, we believed that she actually met the requirements, the statutory requirements for director. The Attorney General at that point was Ruth Babbitt. He didn't feel quite the same way. But the reality of life is we were able to successfully get her through the Senate process and confirmed as the first real director of the Department of Health Services. For those that are familiar with the department today, they may not fully remember that when the department was created, it was created with numerous agencies that had responsibility for public health functions, and certainly one major part of the department was the environmental issues, water, air, solid waste. In those days, we had copper smelters as a major issue to deal with. We had ringed copper smelters with devices to measure the actual effluent and the SO2, the sulfur dioxide that was emitted. And we actually had an expectation that smelters would cut back if, in fact, the wind was blowing the wrong way, or if the effluent being put out was too toxic. It was an exceedingly political exercise at that point, since not all of the copper smelters felt that the regulations that we were trying to enforce were applicable to their unique operations. But ultimately, the Department of Economic Security was created, and we actually moved staff. I had the pleasure of even deciding which staff, which computers, which desks, which chairs would be moved out. The department also was the incubator for ACCESS, the Arizona Hospital Cost Containment System. We started it here with one person doing the development, and then we went to the legislature and developed the legislation and implemented and created and brought up ACCESS in the Department of Health Services. And in those days, ACCESS was designed to limit cost. If you even look at the name ACCESS, there's nothing in it that says health. It was designed to limit cost, and it was designed to bring in federal money to take the onus, the responsibility of the financial support off the counties and onto the state with federal funds. In those days, half the legislature was thrilled that they had avoided getting into Medicaid, and the other half of the legislature was thrilled that they, in fact, had become a part of Medicaid. Today, of course, Access, as the first statewide managed care program under the Medicaid statutes, continues to be a model for the rest of the country. So the department has a lot to be proud of, and I was thrilled to be part of its history and part of all of the fine things it did and still do it still does for the public in Arizona.